Really?
And the people that I talk to at Stanford and the people that I talk to in Minneapolis and in Boston say, we think what you have going on here is unique and special, and how can we either get involved or clone it in areas that you might think have already established their basis. They're looking to us as leaders now.
Mark Lowe's with the Global Cardiovascular Innovation Center. Dr. Gershon of the NeoUCOM, you wanted to jump in there.
I did, and you bring up a great point, because if you look at some of the organizations that we've put together in the state, and Wilmer Benjamin is here from NOCHE, the Northeast Ohio Commission on Higher Education, which is a conglomerate of public and private institutions and the business community working together to increase literacy, to increase numbers of students going to college and graduating and so forth. The Inter-University Council of Ohio, which includes the 14 public universities, actually get together. The presidents meet every 2 months and talk about collaboration, talk about how to work together, advocate together, share resources, and so forth. So I agree. This state is very unusual in terms of people working together, and if that's the case, there's no reason we can't work together to form a brand.
I want to ask this question, India Pearsley. I'd like to start with you. A little bit of context for the question. We spend, this is completely out of left field from what we've been talking about, but we only spend about $39 per person on public health in the state of Ohio, and you get what you pay for, right? So we don't have great public health. We have obesity problems, we have health disparities, we have a local healthcare facility that is partially powered by a coal plant that is very nearby. Shouldn't the medical capital be a healthier place?
Absolutely. And I think that, you know, as we begin to talk more about sustainability and being green, I mean, if you look at the campuses of all these organizations, everybody's trying to figure it out. How do we create opportunities for renewable energy? How do we look at sustainability in the neighborhoods in a different way when we look at all the vacant land around these institutions? How do we green up our city, but also educate our community so that it's more sustainable? Look at the local food agriculture that's going on right now. I think that, again, and the theme that you hear here is everybody has all these collaborations. Wouldn't it be great if we put all those collaborations in the room and really leverage our resources in a different way to become that green city on the Blue Lake? The Mayor's Sustainability 2019 Summit is coming up next week. And so there's an opportunity to fold the medical capital along with all the other initiatives going on into this in a different way to make this a more sustainable community. And I think that's somewhere else we could lead. You know, everybody thinks that someone said you have to go to Portland, Oregon. I think we can do it here in Cleveland.
Dr. Gershon.
Along those lines, health and wellness is a great place for that, because why don't we form a commission, a regional commission or a statewide commission in health and wellness, and get the business community together to have a healthier workplace. Get the schools together to serve healthier, nutritious food to the students and have them exercise more. Work with city planners to get people to walk to work instead of getting in their car and going into cul-de-sacs. There are all kinds of things we can do to get to have us take more responsibility. If we're going to be the medical capital, we need to have some skin in the game, and all of us need to participate in being healthier and have those kinds of behavioral activities that are going to bring the cost of healthcare down and keep things under control.
Ken Walker of Magnet.
Yeah, one of the things that Magnet is doing is we're also working with manufacturers with our program called EcoSmart. That also helps them learn how to be more sustainable in areas everywhere from their processes to reducing scrap. We're trying to pioneer a program whereas some companies' excess scrap will be able to be utilized by some other company as far as production. Also working with companies in terms of their product development processes, making those more sustainable. And taking a whole broad approach to sustainability, not only from the product and process side, but also from attitudes as far as people and the culture, as well as to what their environment is, as far as the building is concerned. Making sure that the buildings are healthy for the workers to be in. And we've determined, the studies show that a lot of consumers out there appreciate companies that are more sustainable. They're willing to pay more for that, and workers are willing to maybe even take less money to work for a company that is focused on those particular areas, working on being a more healthful type of work environment for them. So all that dovetails into the medical capital as far as what you indicated. We ought to be healthy as well as trying to position ourselves as the medical capital for the world.
We are going to stop for a moment. You guys in the audience here at the City Club get to prepare your questions. But before we get those questions aired and answered, turn back to Jim Foster for the traditional mid-program announcements. Jim.
Today at the City Club of Cleveland, we're listening to a special program featuring a panel discussion on Northeast Ohio as a medical capital with Chris Coburn, who is now morphed into Mark Lowe, Dr. Jay Gershon, India Pierce-Lee, Ken Walker, and moderated by Dan Moulthrop. Now we would like to return to our panel for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphones today are City Club Development Director Cheryl Helden and City Club Program Director Carrie Miller. And now let's return to the panel and Dan Moulthrop for our questions.
Thank you very much, Jim. And let me say before we get started with your questions too, if you're listening to this on Thursday evening and you've got comments, you should tweet them with the hashtag MedCap, I believe, and or head over to the Medical Capital blog and join the conversation there. But I think we have our first question.
Yes, we do.
Hi, Anthony Hughes from Aztec. I spoke briefly beforehand. The Medical Capital blog is themedicalcapital.com. I'm on the Healthcare Communicators group and been working with a number of people to get to this point today. One thing that we discussed, and this is more of a comment than a question, but I just want to get it out there because I think it's very important, is that the differentiation between a brand and a conversation. There are a lot of brands around Northeast Ohio, and there are a lot of very smart people doing a lot of good work to move those brands forward. One of the things that we really felt was important is to frame a conversation around Northeast Ohio as a medical capital, not to kind of shove a brand down the throat. There isn't a logo for Silicon Valley with a medical capital because of the facts and the figures that support the case. So really what we want to do is get it into the conversation, insert it into articles, have people talking about it as a frame of reference about Northeast Ohio. And I think that's going to be a critical point moving forward as to the levels of adoption, because if we tell people it's a brand, I think we'll find adoption levels will be quite low.
Okay, not a brand. Noted, everybody? You may repeat the phrase, but do not refer to it as a brand. Another question.
Hello, I'm Mark Gansbury with One Community. So I'm really fascinated, one, by the diversity of the people here and the type of discussion that's going on. There's something beautiful to be had here. I kind of want to set the stage for the question. We're an infrastructure company providing fiber, and we've been real lucky and received a number of grants over the last couple of years, and this year we received another $45 million. One of the things we did, and in going to Dr. Gershon's comment, connecting to the state, is we created something called the Ohio Middle Mile Consortium, bringing over almost $200 million to the state to help innovate the core infrastructure to promote health, education, and government services. It would seem opportunistically, as I talk about clinical innovation, bioinnovation, we talk about manufacturing that's converging from traditional into health, wellness of communities, that part of our dialogue that we're not having is how do all these different investments that are being made, the capital, the brands, come together in an effective way to bring new innovation into the community, the talent that you're talking about, and new financial capital so that we can raise all boats, like you say, and move everybody up. So you talk about a commission or some kind of result. How do you do that, and how do you bring in the right group of people and understand what's already existing within the community to leverage that to do the kind of things that you're talking about?
Dr. Gershon.
I can just reflect on my last position when I was at the University of Colorado. The governor appointed a statewide task force, and interestingly brought in Battelle, who happens to be an Ohio company, to help the state of Colorado bring together and catalog all the infrastructure it had in biosciences, and convince the state not to have separate regions, that northern Colorado and Denver and Boulder and so forth, and to bring it all together into one, because it wasn't big enough, really. And that whole population is 4 million, which is the same, interestingly, as Northeast Ohio. So, but they came up with a report that was sponsored by the governor's office. The business community was involved, the academic community was involved, everybody from A to Z, and had input into that. And at the end of the day, people went with it.
It's as easy as that.